Allergy is an overreaction by the body's immune system to a foreign substance called an allergen. Common allergens include penicillin, aspirin, latex, strawberries, shellfish, and peanuts. Mast cells are a component of the body's immune system and are found in great numbers in the skin, lungs, and blood vessels. When one of these allergens attaches to a drug receptor site on a previously sensitized mast cell, chemicals stored within the cell are released into the tissues in that area. These chemical mediators of allergy are responsible for producing the clinical signs and symptoms associated with allergy. The primary chemical mediator of allergy is histamine, which produces itching, hives, rash, bronchospasm, and vasodilation. Histamine produces virtually all of the clinical signs and symptoms of the allergic reaction, and the severity of which depends upon how rapidly these chemicals are released and where they are released. If the chemicals are released into the skin, which is the most common site, allergy is confined to the skin, nothing more than itching, hives, and a rash. This does not represent an acute life-threatening situation, but it does require immediate treatment. If histamine is released within the lungs, it produces bronchospasm. If released within the cardiovascular system, it produces vasodilation with a subsequent drop in blood pressure and possible edema. These are the life-threatening allergy called anaphylaxis, which requires immediate and aggressive management if the victim is expected to survive. In discussing allergies as a medical emergency, I describe two categories based upon the speed at which the signs and symptoms occur: delayed onset allergy and immediate onset allergy. Delayed onset allergy is one in which the clinical signs and symptoms occur an hour or more after exposure to the allergen. Most allergic reactions are delayed onset, involving the skin, and therefore they are non-life-threatening. Consider a situation where a patient comes into the office an hour after having taken prophylactic antibiotics.
Yeah, I'm just feeling a little itchy.
Yeah, it looks like you've got a little bit of a rash there. Did you take your penicillin this morning?
Mm-hmm. Yeah.
Did you notice the rash before that, or did it start afterwards?
The patient who presented with the mild allergic reaction did not require as aggressive a treatment as a patient who is having an immediate onset or anaphylactoid type reaction.
So I suspect what we've got is just a reaction to the penicillin. So what we're going to do is just give you an antihistamine to calm the reaction down and see if we can't get things under control a little bit, okay? Brian, you want to draw me up some diphenhydramine? How's the family doing?
Good, good, good.
Good. Kids in college yet, or?
I wish.
And what we're going to do, he's going to give me the medicine. I'm just going to give it to you right in the muscle of the arm here.
With a mild allergic reaction, there is really virtually no definitive thing that could be done differently to avoid such a response. The main thing to be done is awareness, both on the part of the patient, part of the dentist, and the part of the staff, as well as the pharmacy and any other professionals involved, that there's always a potential for an allergic reaction to any medication at any time, and it should be reported immediately if it occurs.
Immediate onset allergy is when the clinical signs and symptoms develop rapidly, in seconds or minutes following exposure to the allergen. This allergy involves not just the skin, but also the respiratory and/or cardiovascular systems, and requires immediate and aggressive management with drug therapy if the victim is to survive.
Hi, Stacy.
Hi.
How are you?
Not so good.
Did you take your penicillin?
Yes, but my throat is feeling really tight, itchy, and my lips are feeling really weird.
Let me call, see if the doctor will see you right away. Hi, Kristen. Stacy Cannon is out here. I think she's having problems breathing. Can you see if the doctor will see her right away? Great, thank you. Stacy, the doctor will see you soon. Could you go ahead and take a seat?
Treatment of the anaphylactic reaction follows the PABCD sequence. Position the victim appropriately. If unconscious, place in a supine position. If conscious, whatever is most comfortable for that patient. With the unconscious patient, airway, breathing, and circulation are assessed and done if needed. Have one of your staff activate 911.
Just stay calm.
hand me the green Twinject and go ahead and start some oxygen for her. You okay? That's all right.
Immediately get the epinephrine syringe and give an injection into the patient's
Got
thigh.
a little bit of a stick coming in your leg here, okay? Okay, great. Thank you. Okay, great.
I'm gonna go wait with her.
That's wonderful. Okay. You're doing fine. You really are.
Epinephrine is administered as soon as possible at the onset of apparent anaphylaxis. If there is any doubt as to whether or not anaphylaxis is occurring, it is generally better to administer epinephrine than not. Epinephrine is the drug of choice in anaphylaxis because it does two things that are of critical importance. Number one, it is an excellent bronchodilator. If bronchospasm was a component of the reaction, the airway should now be dilated, permitting more normal breathing. Number two, epinephrine also elevates the blood pressure. In many anaphylactic reactions, the blood pressure drops. And most importantly, epinephrine given IM works fast. Remember, while the victim's life is still in danger, continue PABC as needed and administer epinephrine every 5 minutes until the victim either recovers or until help arrives on the scene.
It's been a few minutes now, so I'm just going to get ready to give you a second injection of the medicine, okay? Okay, you just try to relax. Okay, sweetheart, just relax for me, okay? You're doing great. Okay, you're doing great. Okay. It's all done. Just relax. It'll be great. It'll be fine.
Once your life is out of danger, then the histamine blocker diphenhydramine is administered IM.
Great. Come on in, guys. Everything good, Kara. Just relax. Hey, how are you? Looks like Stacy here is having a little bit of an allergic reaction to the antibiotic.
Okay. How long has that been going on?
She arrived at the office about 20 minutes ago,
Okay.
and she was in slight distress when she got here.
Okay, have we done anything for her?
Yes, she's had 2 doses from the Twinject.
Okay, let's go ahead and we'll transfer their oxygen.
Epinephrine does not reverse any soft tissue edema that may have occurred. However, it will stop any further increase in swelling from developing. The importance of epinephrine administration is emphasized by the fact that in the anaphylactic reaction, there is no absolute contraindication to the administration of this drug.